This is our final talk in the series on developing a research proposal, and we're going to focus on ethical considerations. Ethical considerations are one of the most important things we need to think about when developing a research proposal, and I just want to take you through an organized way of thinking about ethics in research. So, the objectives of this lecture are to identify and address ethical issues impacting on your research. Let's think a little bit about research ethics. So, there are some key specific principles we need to cover when thinking about ethics in research. These include the concept of beneficence and non-maleficence, or put simply, first, do no harm. We need to respect the autonomy of our study subjects. Consider justice, informed consent, integrity, confidentiality and data protection, and conflict of interest. We will think about some of these in more detail now. So, as we said, when we think about beneficence or non-maleficence, what we're really thinking about is a principle common to healthcare and healthcare professionals, which is first, do no harm. Bearing in mind that the harm we can impact on study subjects goes beyond the physical. It might be psychological, financial, or even reputational. Research often looks at questions that are unanswered, so sometimes we actually honestly don't know whether we may be causing harm to the individual by doing our research, but on balance, the benefit must outweigh the risk. This is particularly important when we're thinking about drug treatment or other interventions, but actually bear in mind that for some sensitive subjects, just the process of interviewing a candidate or collecting data from them may provide some degree of risk to them. And then also remember that while some risks are predictable, some may be unexpected. Think about unusual drug side effects or the impact on a person's reputation if certain information about them might be revealed. In some settings, things like their sexuality, past criminal record may all cause problems for individuals. Study subject autonomy is a very important aspect of ethics. When we include somebody in our research, we expect that they can make autonomous decisions, free from our coercion, and with respect to their dignity. Therefore, there are special considerations when we are doing research on patients who lack capacity, such as young children or patients with mental health or intellectual limitations. And in this situation, we need to ensure that we are protecting the dignity and safety of the study subject and respecting them as an individual. What about justice and integrity? Well, we have to make sure that when we are conducting research, we are treating all study subjects and potential study subjects equally. Are we including minorities in our research? Is there any gender or age bias in our study sample? Is any selection bias going to impact on the equity or selectivity of our research? And do all relevant sectors of the population have equal access to this research? Are there language barriers or barriers in terms of religious beliefs that will stop people from taking part in research? All of these questions involve justice. What about integrity? doing the right thing? Well, remember, we need to think about moral integrity. Our research must be based on honesty, free from fraud, and for any researcher here, free from plagiarism. We need to speak about plagiarism as a separate topic altogether. Research of the highest integrity must meet certain quality standards in terms of the research itself, in terms of the clinical practice that is being investigated, and in terms of communicating with our study subjects and with the general population. These days, research is not something that is just simply done behind closed doors. And finally, research integrity depends heavily on the ability to maintain our objectivity as scientists. So we must be sure that our research is free from bias and that there are no unwanted external or internal influences on the way we conduct our research or the way results are interpreted. Informed consent links closely to patient autonomy. We need to give people enough information about what we're going to be doing to them. So we need to explain the research, risks, benefits, and make them understand that they can opt in or out and how to do so. When we give this information, we have to be sure that our patients understand what we're saying. Therefore, we need to use simple language and provide time for explanation and clarification as necessary. This can be difficult in an emergency department setting, but it's crucial. There must be no duress or coercion to join the study. Patients must be free to either opt in or out based on their own personal decisions. So you need to give them time to think, preferably away from you. You can't be hovering over them while they try to make their decision. The actual consent procedure should, as far as possible, be done in a neutral environment. If you or your relative is sick and in the emergency department, depending on treatment from the doctors around you, then in that setting, somebody coming to you asking for research may not really be a neutral environment. And people need to have time to consult with people that they trust, their family, their friends, that sort of thing, before they consent. You're collecting patient data. It needs to be confidential. Data should be anonymous, and once collected should not carry any individual or personal identifiable data. The data should be kept private and in a secure location. Think about breaches of electronic security if you are keeping data on a computer or maybe in a cloud-based system. And you need to think about data protection both in terms of electronic data and hard copies. If we want to be truly objective, we need to avoid conflicts of interest. These may be direct, things like you're employed by a drug company that is doing a research project, or you're being paid to do this research or sponsored to do the research. But there are indirect forms of conflict of interest. There may be some other personal gain you're getting from the research. It may impact on other commitments. You may be doing research on somebody's drug, but you have some other contract with the company for something else, for example. Or there may be other obligations. Often drug companies come and tell us, why don't you use our drug and tell us how it works? Well, that's not really research, because that comes with obligations. Or your dependents or partners may have ties to drug companies or other sponsors that reduces your objectivity. You at least need to go in clear-eyed about this sort of thing before you start your research. So, this is the end of our 5-talk series on developing a research proposal. If you have any questions, you can post them on the discussion board. This talk focused on ethical considerations pertaining to your study, and the final task on the worksheet is for you to think about your own study and how you deal with any of these ethical considerations that arise. Thank you.